Hey everybody, it's Dr. Nelson. We're talking about conditions we treat and why we're so successful with those. We're talking about low back pain right now, so thank you for watching. Right now, a lot of people are dealing with low back pain either because of a car accident or they took a step off of somewhere funny, or they're dealing with issues with low back pain because they're carrying kids a lot, they're carrying a heavy load, hardworking people. So no matter how you got there, there's going to be some issues with the low back. A lot of things should heal themselves. So a lot of people have low back pain for a long time, and my question to them is, why hasn't it healed itself? What do you think? So what I commonly find, now there's some other things that can be going on, so starting with a good consult and exam is super important. We need to make sure that we're clear on what the cause is. We can treat symptoms all day, but unless we address that underlying cause and get to that root of the problem, it's gonna come back. And if you're going to invest in your health, you're going to invest in your care, I believe you're going to want to get to the root of the problem and really knock that sucker out once and for all. That's how I like things done, and I imagine that's how you like things done too. So if you have inflammation in the low back because the joints aren't moving correctly, it'll tick off the nerves, and those nerves will start messing with all sorts of things. This can affect everything with blood flow all the way from the feet down. So if your feet are cold all the time, if you have low back pain, hip pain, knee pain, ankle pain, foot pain, if you have plantar fasciitis, if your knees aren't working like they're supposed to, they're not regenerating well, if your hips are crunchy, tight, or there's like a popping noise in your hips when you're moving it, that could all be a sign that you actually have low back problems, with or without pain. The issue here is that the nerves are inflamed, they tighten up the muscles. The muscles get really tight, they lock up the joints don't move like they're supposed to and piss off the nerves that they house. And so this goes round and around because the nerves run the muscles that are connected to the joints that house the nerves. And it's there to protect your body in case you get hurt. Same way as if you get popped in the ribs, you cover down. It's protective. But it's been left there and hasn't been addressed properly because people don't know what to look for. The mainstream medical establishment isn't trained to look for things in the physical medicine space like chiropractors are. So that's an additional service we can provide on top of the life-saving services that Western medicine is so good at. So the issue here then, especially, is that your brain has to be able to talk to your body, but it does that through the nerves. And so if the nerves are inflamed, it's like playing a game of telephone. Can you get the message across? Can you do the healing? Yeah, but it's gonna be not nearly as effective. So do you have to go to a chiropractor? No. Can we help you heal faster, better, and stay better longer? Oh yeah, almost guaranteed. So that's what I love to do for this. We teach people how to release a lot of the muscle tension with lacrosse balls. So we teach you how to do this at home. It takes about 5 minutes a day every day. For the joints, we provide adjustments. Now with the low back, you might also be dealing with degenerative disc disease, arthritis, stenosis, that's when things close down too tight, either of the foramen where the nerve comes out of the spine or of the central canal where the spinal cord goes down. If that's going on, a lot of the times we can provide a traction device and send it home with you and teach you how to use it. Now this is really important because traction or decompression therapy can run anywhere from $50 to $150 for low back cases per treatment. It's worth every penny of it, but for about the cost of one of those treatments, we can send you home with the device that will allow you to treat yourself. Now you have a skill and you have the tool. And so if anything else pops up in the future, you can take care of yourself and you can save tons of money. A lot of people for traction therapy need about 30 to 40 sessions. Why would I bill you for that if I can let you do that at home on your dime and your time? Saves my thumbs, saves your dollars, saves both of our time. I figure it's a fair trade. So we teach you how to do this. We get your low back, the joints moving appropriately with that adjustment. We may or may not recommend a traction device for you. And then we help the nerves calm down with something called red light therapy. You may have heard of it referred to as cold laser therapy, low level laser therapy. It has a lot of different names. It's incredibly healing, very comfortable. Most people only feel a little bit of warmth. We have a couple of different frequencies we use here in the office. Each frequency does a different thing primarily, but the Spark Notes version is that it helps to decrease pain, decrease inflammation, and speed up healing by 2 times. So then when we come through here with this little downward spiral here, we turn it into an up spiral because it's just a spiral. Do you want to ride that slide up or do you want to ride that slide down? It's up to you. So we help the muscles relax so that the joints adjust easier. It makes those adjustments so much more comfortable. The joints then are moving properly. We get those adjusted. Now the nerves are much more free. The red light therapy additionally helps the nerves, and then combined with the muscle therapy over here and the red light therapy, the nerves and the muscles calm the heck down. Your brain and body is connected so much better. It's able to communicate better, and you're able to express that health and vitality. So you don't just have extra years, you have quality for all the years of life that God grants you. So thanks for watching. See you guys in the next video.